All right, so thank you everyone for joining us today. AASC has a partnership with ProSenior, and ProSenior is focused on preventing Medicare fraud. So through that partnership, we try to work together to make sure you guys have all of the information and resources that will assist you with better serving your residents. Through that partnership, we are able to have our lovely presenter, Ms. Linda Kerdolff. She is with the Ohio Ombudsman Program, and she is the program director. So with that, I'm going to turn things over to her, and thank you, Linda, for joining us.
Awesome. Thank you, Nina. Hi, everybody. So I'm glad to be here today. As Nina said, I am a long-term care ombudsman, and we'll talk about what that is and what long-term care is. So first off, I am with Pro Seniors. Pro Seniors is a nonprofit. We're located in the Cincinnati area, and as we say on the screen here, we do work to resolve legal issues, long-term care problems, and help fight Medicare fraud. And so there we go. Those are our three main pillars of service. We have a legal helpline, and anybody who is a resident in the state of Ohio over the age of 60 can call our legal helpline and set up a free 30-minute phone call to speak with an attorney. So there are no income limitations. The topic can be anything, and anyone can set up this appointment and speak with an attorney. Then the second important pillar is the Senior Medicare Patrol, and Kathy will be on later to tell you more about that. And then I am with the Long-Term Care Ombudsman Program. So I want to tell you more about what that is, what we do, and when you might want to give us a call or make a referral to us. So I'm going to talk about what is long-term care, what are the options, what are the residents' rights, how does it get paid for, and any questions you might have, pop those in the chat and we will get to those. So you or your resident, somebody's in the hospital, the social worker says, okay, the doctor has discharged you, but you need to go to a nursing home for rehabilitation or a long-term stay. So where would you like to go? And most people are deer in the headlight. Something traumatic has already happened and there's a lot of emotions running high, and you're being asked, where do you want to go? And most people don't have an answer for that. Or you have a loved one in a nursing home and they tell you the aides call me names, or I haven't had a shower in 3 weeks. So what do you do about that? And then mom says she's buying groceries for her home healthcare worker. Is that okay? And it's not. So when would somebody need long-term care? Long-term care is based on an assessment. So your loved one, your resident, your client, someone is having an issue, maybe something's happened, there's been a stroke, there's been a heart attack, maybe it's diabetes, who knows. An assessment is done. The assessment can be done by the local AAA, or it can be done by a nursing home, but someone is going to conduct an assessment to determine what are the needs of this person, and it's largely based on ADLs. So does this person need help with medications, bathing, dressing, toileting, ambulating or walking, eating, transferring, which is bed to wheelchair or wheelchair to shower, something like that. And so a determination is made what level of care does someone need? And so the assessment says, well, if this person needs help with 1 or 2 ADLs, maybe assisted living is appropriate. If this person needs help with 3, 4, 5 ADLs, then probably a nursing home level of care is appropriate. And we're also going to touch on, I'll get to this in just a little bit later, group homes, adult group homes, which are known as RF2s, residential facility class 2. That might be the appropriate option, or home health care. We all want people to stay in their homes as much as possible, and sometimes with long-term care services available in the home, that's possible. So the long-term care network looks something like this. In Ohio, there's 960 nursing homes, 725 assisted living. Technically, they're known as residential care facilities, but more commonly, we call them assisted living. And then there are these adult group homes, which are RF2s, residential facility class 2 homes. And then there's an awful lot of home health agencies. And so by 2050, the number of individuals needing long-term care is going to double. And that comes as no surprise to anyone, I'm sure. We all know what the demographics are doing, you know, up and to the right with the number of people that are aging. And as we age, more often than not, we all think, well, I'm not going to be the one who needs a nursing home. And then things happen, life happens, right? So there is something called the Long-Term Care Ombudsman Program. Now, this is a nationwide program under ACL, the Administration for Community Living. So every state has an ombudsman program, and in Ohio, we have an office in Columbus. And the job of an ombudsman, we go around and we physically visit all these nursing homes, all these assisted livings, all the RF2 group homes, and we are to be there on a regular basis. By law, we're required. And so quarterly, we come to these facilities and unannounced, and we're there to talk to the residents. We want to find out what their experience is like, how their care is, quality of care, quality of life. We want to educate the residents to let them know that they have rights living in long-term care. There's actually 33 resident rights spelled out in the Ohio Revised Code. And we want residents to know that they should always be treated with dignity and respect, that they have a right to choose their physicians and their pharmacy, that they have a right to all their medical records, etc. And so we want the residents to know these rights, and we're also going to do our best to empower residents. You know, we want them to feel confident that they should expect quality in their care, that they have rights, and that they should speak up for what they need and their preferences, what they want. And so then, and sometimes they don't know who to go to. So they're in one of these facilities, and you know, we want them to know, okay, well, your transportation didn't come for your dialysis appointment. Did you talk to the social worker about that? Do you know who the social worker is? Do you know where the office is? Would you like to walk down to the social worker's office with me so we can talk about this? So that's part of our empowerment to help residents with the quality of care, quality of life in their living setting there. And then when someone wants our help, we will advocate on behalf of the resident. So with their consent, we will go to the director of nursing, the administrator, the social worker, the activities director, the dietitian, whatever the problem might be, we're going to go there and do our best to resolve the problem on behalf of the resident to the resident's satisfaction. So that's what an ombudsman does. And in Ohio, there are 11 offices. And so Pro Seniors were down there in the corner, Southwest Ohio. We covered Hamilton, Butler, Warren, Claremont, Clinton counties. But there are 88 ombudsmen throughout the state of Ohio. And you can find your local office either on the Department of Aging website, or you can give us a call here at Pro Seniors and we'll connect you to the nearest long-term care ombudsman office. As I mentioned, there are rules and regulations that govern what happens in long-term care. And these regulations that I'm going to talk about are for mostly nursing homes, but they also apply to assisted living and RF2 group homes. Nursing is the most complex level of care, so that's why I'm going to talk more about nursing homes than the other congregate settings. But there are federal regulations, there are state regulations and rules, and what we're going to talk about today is this ORC 3721.13, and that is resident rights is what I want everyone to know about. So in the federal law and therefore the state laws, the two broad themes, and you've already heard me use these terms, are quality of care and quality of life. And these are the definitions, the legal definitions. So quality of care says a nursing facility must provide services and activities to attain and maintain the highest practicable physical, mental, and psychosocial well-being of each resident. And that is done through a tool called a care plan. I'll talk more about that in a little bit. But also quality of life. So the nursing facility must care for residents in a manner and in an environment that promotes the maintenance or enhancement of the quality of life of each individual. So we have to remember that folks living in these long-term care settings, this is their home. So it's important what quality of life they're experiencing. It should feel like their home, not like an institution. So these 33 resident rights that I mentioned can kind of be put into these 4 buckets. So I want to talk about the residents' rights in terms of communications, the choices that should be honored, their decision-making, and their right to participate in decisions about their life. So residents have a right to be fully informed of rules, policies, a resident's responsibility in a language the resident understands. So what that means is maybe the resident comprehends on a 4th grade level, so the language should be simple. Maybe Spanish is their first language and their English skills are limited, so it should be presented to the resident in Spanish. Policies of the nursing homes cannot contradict the resident rights. The resident rights that are spelled out in the Ohio Revised Code trump any policies. You can't have a policy that takes away someone's rights. For example, there's a lost and stolen article policy, and the resident has a right to have lost and stolen items replaced or reimbursed. The residents have a right to voice a grievance. So there's a formal grievance procedure in all these facilities, and the resident has a right to go through that procedure, meaning they fill out a form, they indicate what their grievance is, and the administrator is responsible for responding to that resident there in a timely fashion for their exact grievance. And all of this without fear of reprisal. Unfortunately, sometimes we have residents who are afraid to speak up. They have to live there 24/7. And, we're not going to force someone to speak up if they fear reprisal, but reprisal is against the law. And, but sometimes it's subtle, right? Sometimes it's an aide that takes a long time to answer the call bell because they've decided they don't like this person because they filed a grievance. But as an ombudsman, those are the things we try to get to the bottom of and try to prevent from happening. So residents, this is a term you may hear or should hear, person-centered care, which means that the residents' desires and wishes and preferences should be honored wherever possible. If someone is a late sleeper, they should be allowed to sleep in during the day. If someone prefers or wants to eat kosher or wants to eat whatever their preference is, vegetarian, that should be honored. And the resident has a right to make these decisions, meaning a right to direct their patterns of everyday life. So eating, sleeping, meal times, religious practices. If someone wants communion once a week, that should be accommodated. Residents also have a right to access their community, and that could be inside or outside of the facility. So in a nursing home, the nursing home should arrange for transportation if someone wants to be at mass once a week or something like that. The resident has a right to choose their visitors, and maybe this will come as a surprise to some, there aren't visiting hours. Yeah, a nursing home cannot say, well, you can only visit between the hours of 9 to 5 or 9 to 6. Visitors can come at any time. Now, if it's late at night or early in the morning, they do need to be respectful of other residents, meaning they're not making a lot of noise or waking up someone's roommate. But residents have a right to have visitors at any time. And a visitor could be family, but a visitor could be anyone. And what's important is that the resident is kept involved in the decision-making process. These are grown adults. They've been making decisions their whole life. And yes, there are people who are experiencing dementia. Maybe some people have lost capacity to one degree or another. Capacity is a continuum. But to the extent possible, the residents should always be involved in the decision-making process, unless, as the first bullet point here says, unless they've been adjudicated incompetent by a court of law. And what that means is they have a guardian, a legal guardian. Guardianship is a legal term. It's determined by the probate court. But even someone with a guardian can express they prefer green Jell-O over the red Jell-O. So to whatever extent they can make the decision, that should be honored. And residents do have a right to refuse treatment. They do have a right to leave the facility. It's called AMA, against medical advice. They can do that. Now there's some consequences. If someone leaves the facility AMA against medical advice, they may be putting at risk Medicaid. If they need Medicaid in the future, it could be denied because they've left AMA. And residents have a right to full and accurate information, which includes alternatives. So yes, you can refuse to take your insulin, okay, but it is the nursing home's responsibility to explain the consequences. If you do that, these are the consequences, and well, you know, ultimately you could die. So, but the resident does have a right to refuse. So, an ombudsman, what we're all about is advocating for all these various rights. So the last bucket here, the 4 buckets that I'm putting the resident rights into, residents should participate in this care plan. Now in a nursing, so both assisted living and nursing home, everybody has a care plan. A care plan is a document, and it is initially put together when somebody enters the facility by everybody on the team. So there's a section for the social worker, there's a section for the activities director, there's a section for the dietitian, there's a section for preferences, there's a section for the DON and all the medical, and it spells out someone's treatment and care and preferences. So the resident prefers to have showers in the evenings, not in the mornings. That should be accommodated in the shower schedule and written in the care plan. The resident needs to be checked and changed every 2 hours. That should be written in the care plan. So a lot of times when there's a problem, we can use the care plan. We call for a care plan meeting, conference, care planning conference, get all the players in the room and make sure it gets written into the care plan, the solution for something that might be happening. So, you know, as an ombudsman, we see a variety of issues. They might be lost laundry. They might be there's not enough linens. There's not enough clean linens. It could be there was some cash stolen out of my drawer. And then we see some very serious issues of abuse, neglect, and exploitation. So, you know, and those are serious matters. The police may need to be called for financial exploitation, the bank, the Attorney General's office, you know, abuse, the Ohio Department of Health. So, you know, for the very serious matters, we probably are going to involve other agencies or, you know, even the law. But in all these matters, we want to make sure all residents are safe. We want to make sure all residents are cared for and they have a safe living environment and quality of care. So that's just gives you, I'm trying to give you a scope of ideas of the problems that we encounter and try to resolve. And also, when any of these things come up, that's when you can call the ombudsman and involve us. Back to the care plans. In a nursing home, they happen quarterly. The residents should always be a part of this care plan meeting. It's literally in a conference room with, the resident has the right to have whoever they want in the care plan meeting. They can have family, they can have the ombudsman, they can have, if they want the aide that usually takes care of them, or the maintenance worker, whoever they want, they can have in this care plan meeting. And in addition to holding them quarterly in a nursing home, A resident can request a care plan meeting at any time. Even if they just had one last week, they can make a request and say, I'd like to have another care plan meeting to discuss anything, whatever they want to discuss. In assisted living, it's required to have, they call them service plans, and those are required to be reviewed once a year. Residents have a right to participate in resident council, and nursing homes are required to have resident council meetings to support that. So it, as the name implies, it's the residents get together once a month, and it's a forum where they can discuss issues, grievances, maybe things they'd like to do, any topic. There is a resident who is elected as the resident council president. Some of these resident council meetings are run more formally, some less formally, but we always encourage residents to attend these because it's another tool to try to help get better quality of care or better quality of life, depending on what's going on. Residents have a right, I've already mentioned, to participate in their community activities, whether that's social or religious or family. Nursing homes and assisted living are licensed by the Ohio Department of Health. The Ohio Department of Health has an annual survey process where they come in and they review 150 regulations. It usually takes about 3 or 4 days. At the end of this review process, there is what's known as an exit survey, and residents have a right to attend that meeting where the results are reviewed. And residents have a right to speak to an ODH surveyor while they're there and on any topic they want to. So residents have a right to participate in this regulatory survey process. Okay, so those 4 buckets summarize the resident rights, the 33 resident rights. And if anybody's interested, I can send out the ORC 3712. So if you're interested in the legalese of how that all is written out, or call your local ombudsman office. Another service that the ombudsman program provides is called selection assistance. And here at Pro Seniors, we call it home options. And what that means is that anyone can call us, and we will walk you through the process of how to choose a nursing home or assisted living or a group home. You know, what questions should you ask? What should you look for? Should you go visit? Absolutely. So there are services out there. You might have heard of some of these. A Place for Mom, Caring Place. There's probably a dozen services who advertise, and they are free to the consumer. You know, we'll help you choose a nursing home. It is free if you're using that service, but those paid services, they get paid by the nursing home to make a recommendation. They basically get paid a commission. Every time they make a recommendation and somebody goes with that recommendation, they receive a commission check. The Ombudsman program provides that same service, except we are unbiased. We will show you data, and we do not get paid. Again, the Ombudsman program is government funded. So we actually do not make specific recommendations, but we can help people understand their needs and again, narrow in on some facilities. There's a couple of great websites that we recommend. Ohio just launched something called the Nursing Home Quality Navigator. So that's a really good website where you can see data and you can see, has this facility been reported for abuse? Who owns this facility? And so anyone's welcome to call our intake line, our help line, and we'll help walk people through that process. You know, as I mentioned on my very first slide or an early slide, oftentimes we don't plan ahead, right? Just like putting together a will, we don't want to think about it because none of us want to think about our demise. So we don't think about, well, what if I need nursing home care? Where would I go? So most people do not plan ahead. We wish they would, and we're here to help if somebody does want to plan ahead. But most of the time, the decision is made under duress. You know, again, you're in the hospital, you've got to make a decision. And so we want to encourage people to plan ahead, and we'll help in either scenario, whether somebody's planning ahead or they've got to make a decision right now. We'll try to walk through the process and advise people what to look for and what to do. Our website has some great resources. You know, let me point out what, an example. A nursing home, there's one fee per month, and it's all inclusive. So that means it's your room, it's your food, it's your care, it's your medications. There's the one fee. Assisted living is actually set up differently. It's more of an a la carte pricing. So there's a base fee, which is basically room and board, and your meals. And okay, you need help walking down to the dining room. Sure, we'll do that, but there's a fee. You want the assisted living to do your laundry. That's great. They'll do it, but there's a fee. So just understanding the difference between a nursing home and assisted living, you know, will help with that. With dementia care, there's some pretty significant things to think about if you have a loved one with Alzheimer's or another type of dementia. And, you know, has the staff received specific training? The activities should be specific for dementia type residents. You know, people with dementia probably aren't going to do well with bingo, right? So there should be other activities that are appropriate for that population. Again, anybody can call the Ombudsman program and we'll help walk through all these things. So switching gears a little bit to what does long-term care cost and how does it get paid for? Because not everybody is familiar. So this slide is a little bit dated. As you can imagine, the costs have only gone up, not down. But if you need home health care, you can expect maybe to pay this type, and this assumes 44 hours of care per week. Sometimes it's a lot less than that. If you need around the clock, it's going to be a lot more than that. Adult daycare, assisted living is actually, because of those a la carte fees I was talking about, is probably closer to $6,000 a month. And then nursing home is, in Ohio, a semi-private room is actually closer to about $8,000 a month on average. Now, you can pay $12,000, $15,000 a month for nursing home skilled level of care. And so that's a lot of money, right? Most of us don't have that kind of money just sitting around. So what happens? How does this get paid for? Medicare will pay for at most up to 100 days. So day 1 to 20 is paid for by Medicare, and Medicare pays the nursing home. I think it's $465 a day. So nursing homes like days 1 to 20 because that's good money for a nursing home. Day 21, Medicare will still pay, but now the individual, oh, I see I need to update my slide here, has the co-insurance to pay, which it's closer to $200 a day now. So 200 a day adds up pretty quickly. That's a chunk of money, but that is the liability that someone in a long-term care nursing home is obligated to pay if they're there day 21 through day 100. Day 101, you as a resident, you as an individual are responsible for all costs. So now we're at $8,000 a month or 10,000, 12, whatever. The average cost is $8,000 a month. So what do? Well, you're going to dip into your savings. And if, some people have some savings, some people don't. Some people have long-term care insurance policies. Some do, some don't, right? They're not terribly popular. They're a little bit expensive, but some people have them. The long-term care insurance policy, you got to read the fine print. This is where that term ADLs comes into play again. The policy may say, the insurance doesn't kick in until you have at least 2 ADLs. Okay, so if you're in a nursing home and you're only getting help with medication, long-term care or assisted living, long-term care insurance, your policy may not pay for it. You got to read the fine print on those policies. If you are a veteran, there are VA benefits for long-term care, so definitely contact the Veterans Association. Only certain nursing homes are contracted with the VA. In our Southwest Ohio region, there's only 7 or 8 nursing homes that will accept VA benefits. So you have to know that ahead of time. If you plan on using VA benefits, you want to know which nursing homes those are and make the decision that way. What happens more often than not, people, if they have to stay in long-term care, they blow through their savings, right, and need to go on Medicaid. So there's all kinds of rules and stipulations that go along with this about your monthly income, spending down your assets. If there's a spouse involved, there's another set of rules. And there's actually 200 types of Medicaid. So you need help, right? If you're in the nursing home, the social worker at the nursing home should help you apply. There's an application process. There's a 5-year look back period. You can also call Pro Seniors, our legal helpline. We get a lot of calls about Medicaid and specific circumstances. And yes, you can keep a house if you say you intend to return. You can keep an automobile. Now you have to keep up fees on all of that. You got to pay the property tax and keep up the gas and electric and pay the auto insurance, but you do not have to sell those assets to go on to Medicaid. So anyway, it's pretty complex. The ombudsman can help you, or the legal helpline. But that's how long-term care gets paid for. I believe 60% of residents, maybe more, are on Medicaid. It's referred to as institutional Medicaid. That's not a great name, but that's what it's called. Okay. So now I want to talk about these RF2 adult group homes. I kind of mentioned it early in the presentation. These group homes, they're a congregate setting. It houses 3 to 16 people. There's usually 4 or 5 people in a home out in the community. These are licensed and managed by the Ohio Department of Mental Health and Addiction Services and OMAS. So as the name implies, these are individuals who have mental health or addiction services. And what that usually means, they usually don't have ADLs, but they need help with medication. Medication is an ADL. And transportation. So it's basically room and board, 3 meals a day plus a snack, help with medication, help with transportation. And so sometimes your clients or residents, this is an appropriate setting. This is, you know, someone doesn't meet the level of care for assisted living, or they don't meet the level of care for a nursing home, but they do need help with medication. They do perhaps have a mental health or addiction diagnoses. This might be the right setting for someone like that. So again, the ombudsman can help you find homes locally, or there's an OMAS website. You can go there. Most residents need a case manager to stay in a home like this, and they need a payer source, which is usually SSI, SSDI, or RSS. Yeah, okay. So those are the 3 types of long-term care that I've talked about today: nursing home, assisted living, and RF2 adult group homes. All right. Here's a handful of resources. The Pro Seniors website has a lot of tools on it. If you want to create a will, or someone needs to create a simple will, we've got a tool that'll walk you through that, and it spits out the documents. Living wills, end of life documents, that's on our website. I mentioned this Ohio Nursing Home Quality Navigator when you're trying to search for and make some decisions about nursing homes. Medicaid, Job and Family Services manages that. These long-term care insurance policies, the Ohio Department of Insurance, or OSHIP, Ohio Senior Health Insurance Information Program, all great resources. I believe we can either take questions, or I can turn it over to you, Kathy.
Well, this is Kathy. I think it looks like someone asked about getting a copy of the PowerPoint, and Nina said she could send that out. So before, I just have a little bit to share about who the SMP is. We work closely with Linda. We're out of the same kind of host organization. But let's just give everybody a chance to either chat or unmute and ask any questions they might have before I get started.
Sure.
Sure. So if anybody has any questions, if you can't find the chat, if you hover on your screen, there should be a pop-up box with a bunch of icons. Just click the chat button and submit your questions. Or if you prefer to come off mute, just raise your hand and I can unmute you.
Okay, it looks like there may not be questions. Let me, I'll go ahead and start my video. I'm only going to talk for just a couple minutes. And if you come up with something you want to ask Linda while I'm talking, then that's fine. I think it shouldn't be an issue. We can always get you in touch with her if need be. So,
do I need to stop sharing?
It's a good question. I can, I don't have to have my picture on there. It's up to you.
Well, if you're going to show a video, then you need to share. So I need to stop sharing.
I'm not showing a video. I just
I'm
meant
sorry.
to turn on my videos.
Oh, that's what you were saying. I'm sorry.
Yeah. Nope, I don't have anything that entertaining. Come on.
Okay.
So basically, Linda came as a guest to the Ohio Senior Medicare Patrol. We work closely with the AASC, and we invited Linda on as a guest of our program because we think that the services provided by the long-term care ombudsman are so important, and we thought it would be a good fit for all of you. The Senior Medicare Patrol, what we do is we work throughout the state to educate older adults about all different types of fraud and scams that they might be exposed to and how to keep themselves protected. The way that we do that is mostly through the use of training volunteers in their own communities where they can make the most impact, because we have a team of 6 and we cover the entire state. So we really utilize help from people who, like you, work in organizations where they're communicating with older adults on a daily basis, or people who are retired and want to give back to their community by doing presentations or hosting booths at events. So we have a lot of information that we can share about how to stay safe, and we would be happy to share that with any groups of either employees or seniors that you work with in your job. So all you have to do is put your information either in the chat or let Nina know and she'll connect you to us, or go to our website and you'll find our contact information there. And we would be more than happy to either come in person to you to give these presentations. We can also do games. We have a fraud bingo we can offer, and we can do remote as well. So keep that in mind. And if you have something you want to plan for residents that you work with, please reach out. And Nina, I think with that, that's all I have. So I don't know if you have anything in closing that you would like to share with everybody.
Well, we actually got one question in the chat. So the question is, in the case of home health agencies, are they periodically monitored or just when there is an issue?
Oh, excellent question. They are not periodically monitored. We only know about it when there's an issue and someone has contacted us. We would like to see some more regulation around that area, because there's dozens and dozens and dozens of these home health agencies. Some are awesome, some are not.
Yeah, a follow-up comment to the question was, a common concern is hours worked. She says she's seen where aides are coming to residents' homes for a few hours, then contracted for, and then having the resident sign off on the hours as if all the hours were provided.
You are correct. That is flat out wrong. As the ombudsman program, we'd like to know about it if that's happening, and it's stealing, right? I mean, you're not providing the service, but you're charging for the service. And yeah, there's a lot of room for improvement in the home and community-based services.
So is there a way that the service coordinator could know how many hours the aide is supposed to be at a property and whether or not they're actually being fraudulent?
So it's done contractually, or there's actually, this is where the AAA, the Area Agency on Aging, is usually involved with a lot of folks, especially someone of lower income. They're probably getting services, home health care services, through the AAA, which the AAA should be notified because it's spelled out in their coverage. You know, the home health aide is to be there 14 hours a week, and what they're to do, showers, light housekeeping, whatever it is. Other people are paying for it privately, and that means they've signed a contract, and that contract should spell out how many hours and what they are to do for those hours.
Wonderful, thank you. Are there any other questions? Yes. Not seeing any hands raised, and I don't see that anyone is chatting. So with that, I think we will go ahead and wrap up. So thank you, Linda and Kathy, for taking the time today to share all this wonderful information with our members. As I mentioned, I will send out a copy of the recording and the presentation once everything gets downloaded. So if you need to get in contact with me, Linda, or Kathy, feel free to reach out to me. Thank you, everyone. Have a wonderful day.
Thanks, everyone.
Thanks, Nina. Thanks, Linda.